you do if someone collapsed suddenly in front of you? Although Kurt stepped up and helped someone he didn't know, you are much more likely to be in a position to save the life of someone you know and love, like a parent, child, spouse, or friend. Today, you'll learn the skills to help respond in an emergency, but that's only half the battle. What would you do if you were standing in that line for coffee? Would you have the confidence to act? Cardiac arrest can occur without warning or within just a few minutes after symptoms appear, and it can occur in both men and women. However, recent studies have shown that in the United States, women are less likely than men to survive a cardiac arrest, as are underrepresented groups such as Black and Latinx communities when compared with their white counterparts. So it's important to remember that cardiac arrest knows no gender, race, or ethnicity. And in a cardiac emergency, everyone needs CPR to survive. Welcome to Heart Saver CPR AED, presented by the American Heart Association. An emergency can happen anywhere at any time, and this course will help prepare you for the types of emergencies you might encounter. For information on additional topics not covered in this course, please consult your student workbook.
All right, guys, my name is Tamisha. I'm an LPN. I'll be your CPR instructor today. I have been in the health field for about 14 years, and not a lot of people know how to do CPR the correct way. So I'm passionate teaching CPR, and today we are going to learn how to recognize when an adult or child needs CPR, if you're by yourself or with a innocent or from innocent bystanders. It's a pretty lengthy class, so we'll have a couple of breaks. If you need to take a break, just let me know. The bathrooms are behind this door here. And some other things that we're going to go over is choking from an adult or child, how to use the AED, and how to do effective breath with the mouth-to-mouth and the mask.
Use an AED and other life-saving skills. To help you along the way, your student workbook covers all the material and includes quick reference guides. We recommend you put these guides in your first aid kit for easy access during an emergency. If you complete all the course requirements and demonstrate the skills correctly, you'll receive a course completion card. Keep in mind, though, that studies show you should frequently review the course information and practice these skills to maintain your ability to respond to a cardiac arrest. The term heart attack is often mistakenly used to describe cardiac arrest. Although a heart attack may cause cardiac arrest and sudden death, the terms don't mean the same thing. But when and how do you provide CPR? Has the person had a heart attack or cardiac arrest, and what's the difference? Cardiac arrest results from an abnormal heart rhythm. This abnormal rhythm causes the heart to quiver so it can no longer pump blood to the brain, lungs, and other organs. Within seconds, the person becomes unresponsive and is not breathing or is only gasping. Death occurs within minutes if the person does not receive immediate life-saving treatment. A heart attack occurs when the blood flow to part of the heart muscle.
All right, I think they went over what was the difference between a heart attack and trying to go over cardiac arrest. So do you remember what she said about a heart attack, what that means?
Mm-hmm.
What?
A heart attack is when your heart it stops pumping blood,
mm-hmm.
and your body and your lungs don't respond, and you within seconds you pass out.
You have anything to add? You agree?
Yeah.
All right. Let's find out what the cardiac
is blocked by a clot in a blood vessel. If the blocked vessel is not reopened quickly, the heart muscle normally nourished by the vessel begins to die. Heart attack symptoms may include discomfort or pain in the chest, or an uncomfortable feeling in one or both arms, the neck, the jaw, or the upper back. Other signs of heart attack are shortness of breath, breaking out in a cold sweat, nausea, or lightheadedness. For both women and men, the most common heart attack symptom is chest pain or discomfort. However, women are less likely to seek treatment for a heart attack. This may be because they're somewhat more likely than men to experience some of the other common symptoms of a heart attack. These symptoms include shortness of breath, nausea and vomiting, and back or jaw reflux, the flu, or normal aging. A heart attack can lead to cardiac arrest. A person in cardiac arrest needs CPR to survive. CPR stands for cardiopulmonary resuscitation and consists of two parts, chest compressions and breaths. When CPR is needed,
what two parts for CPR do you need?
Chest compressions
And you remember chest compressions and
Chest compressions and mouth to mouth.
breaths. Chest compressions and breath is needed for CPR to be performed effectively.
chest compressions can help blood get to the brain and other vital organs. It's natural to hesitate or to question yourself when faced with an emergency. There are many myths about performing CPR. Myth number 1, true or false? Many Americans are prepared to act in an emergency. False. Most Americans feel helpless to act because they don't know how to perform CPR or are afraid of hurting the person. Unfortunately, less than half the people who need CPR get the immediate help they need before advanced help arrives. Myth number 2, you can hurt someone by giving CPR.
True or false?
True.
Even if someone doesn't need CPR, you're unlikely to hurt someone by providing it. Although it's possible for a person to receive injuries like a broken rib, these injuries are minor compared with death.
So do you guys agree with that? If you're doing CPR and you feel and hear that you cracked somebody's ribs, are you going to continue?
No.
Yes, because I would rather have broken ribs than be dead. So even if you break their ribs, because they can recover from that, then you keep going to save their life.
I have a question.
Yes.
What if it's a child, as in a baby?
So you won't do that type of CPR for a child. You're using fingers. So all those things haven't like fully developed yet. So it's much safer, and kids can they last a little longer without breaths.
Okay.
But for adults, if you hear that you broke their ribs, then you need to keep going.
How would I know when a baby passes out instead of just going to sleep?
Well, they'll have some symptoms before passing out, like, maybe turn a certain color or start sweating, or
Okay.
You would know they're going to pass out, especially if it's not their nap time. They're not asleep.
Okay.
The first one I thought was false too.
The first one you thought was false? The first one was false, right?
Yeah.
Yeah.
It was.
Survival rates drop by as much as 10% for every minute that a person does not receive CPR. Doing something to help someone is better than doing nothing. Myth number 3, you can be sued for performing CPR.
No.
Yes.
We'll see. We got one yes and one no.
All 50 states have Good Samaritan laws in place to protect people who try to help save a life.
You know what a good Samaritan law is?
No.
That means you try to do the right thing. It's like that thing we teach you about integrity, doing the right thing when no one's looking. If you know how to do CPR, you're not going to watch someone die. Initially, you're going to want to get up and help them because you know what to do to help them, right? So if something happens and you try to help them and they end up passing away anyways, you won't get sued because all the 50 states have the Good Samaritan law, which means you attempted to help them in good faith. You were trying to help them even though they eventually passed away.
Okay.
For more information on Good Samaritan laws in your state, check your state government's website. Myth number 4, true or false? AEDs should be used only by healthcare professionals.
Yes. True.
It's only two options, true or false.
No.
You think that's false and you think that's true.
Yes.
False.
You're right.
AED
False.
stands for
AED, we'll learn about AEDs. That machine, she's going to tell you right now, automated external defibrillator. You can't entirely save anybody's life if you can't use the AED. So you're going to not wait for medical personnel to come and use it when you can use it. And all the buildings have AEDs, like your school, wherever we go, when we go to the stores, the grocery stores, everybody has an AED.
for automated external defibrillator. AEDs are safe and easy to use by anyone. We'll discuss AEDs in more detail later. For now, all you need to know is that to operate one, you simply turn it on and follow the prompts. When we go about our everyday lives and something like this happens right in front of us, it may take a few seconds. When we go about our everyday lives and something like this happens right in front of us, it may take a few seconds to realize that this is actually an emergency. When we do realize the urgency, there are steps to follow to determine whether a person needs CPR. First, before you start providing CPR, you need to make sure the scene is safe. Look for anything nearby that might hurt you. You can't help if you get hurt too. Next, check to see if the person is responsive. Kneel at their side, tap them and shout,
"Are you okay? Are you okay?"
If the person is unresponsive, shout for help. Someone who is responsive moves, speaks.
You got that? So when you see something happens, to make sure that they are actually needing help, you ask them, tap them, "Are you okay?" And if they don't respond, you call for help, and then you proceed.
I have a question. What if they move?
So they're going
They cannot speak.
They're going to continue that in this video. Someone who is responsive will be somebody who moves or speaks or just otherwise reacts, period.
Blinks or otherwise reacts when you tap them and ask if they're okay. Someone who does not move, speak, blink, or otherwise react is unresponsive. Here's a demonstration. While leaning over the person who is down, check to see if the person is responsive. Tap their shoulders and ask,
"Are you okay? Are you okay?"
If the person does not move, speak, blink, or otherwise react, then they are unresponsive. Shout for help.
"Help, I need help."
Scene safety and checking for responsiveness. We'll do it with this mannequin here.
Okay.
You want to do it, DJ? Just DJ?
Yeah, we'll have DJ do it first, and then we'll have you do it. But we're not doing anything. We're just checking for scene safety. We're just checking for scene safety and responsiveness for the patient. So, DJ, you're walking through the mall, and you see this patient. He just passes out. I know at first it's going to be a little hesitant, but then what are you going to do? You can stand up. He's laying on the ground.
I'm going to tap his shoulders
And ask him at the same time.
"Are you okay?" And then if he is unresponsive, meaning he does not move, blink, then I will call for help. And if I do know CPR, I would then begin doing CPR.
All right, well, we're going to learn the steps to CPR. But you're right. Just tap him, ask him if he's okay, and make sure that the scene is safe before you start any type of CPR. But we'll go over those things and how you know, what you will have to do to make sure that the scene is safe. Cameron, if you see this man lying down, what if you're at a playground and you see a parent of one of the kids playing, and you see him lying down because you're not too young to do CPR? What are you going to do if he was just lying down? Stand up. And what are you going to do? No, you ask him if he's okay.
"Are you okay?"
Okay, that's good. That's it. You just ask him if he's okay, and you tap him before you do anything. What if he was taking a nap? You can't just go and start CPR. That man gonna wake up fighting. Because I would. Have a seat. You just ask him if he's okay, and you just gotta tap him and make sure that you know it's okay for you guys to start CPR.
If someone is nearby and can help, have that person phone 911 and get an AED.
Did you hear? I gotta turn the volume up a little bit. If someone is nearby, you have that person call 911 and grab the AED. That way you kind of split up some of those duties and you're not stuck doing everything. If you got more than one person, kind of start, delegating people to do stuff.
Say to them, you, call 911 and get an AED. If no one comes or you're alone, then phone 911 yourself and put your phone on speaker mode so that you can use your hands while assessing the person.
Does that make sense?
Yeah.
You call 911 first if you by yourself. If you're not by yourself, you point to that person and delegate what you want them to do. So nobody's confused. If you just say, hey, call 911, they're going to be like, who, me? You just say, you, call 911 grab the AED, so that way they'll know I need to go and do this to help this person.
You'll also need to get the AED yourself. If you're alone and don't have a cell phone, leave the person while you go to phone 911 and get an AED. Quickly return and continue providing emergency care. If you don't know where the AED is, or if there isn't one available, do not delay the start of CPR.
So she's saying, don't start CPR if you are by yourself unless you have called 911 first and try to get the AED first before you start CPR. You don't want to stop CPR once you've started it. Okay.
Why is that important?
Because they can last like so much time between them getting oxygen to their brain is what requires what you're doing to CPR. Like you're providing oxygen to their brain. So you don't want to stop that, because if you stop it, it causes like a higher chance of them dying.
Okay.
Stay on the phone until the 911 dispatcher tells you to hang up. Answering the dispatcher's questions will not delay the arrival of help. The dispatcher will ask you about the emergency, where you are, and what has happened.
That's like the lady off 911. Those are where the dispatchers are. They make sure that, you're doing everything you're supposed to do.
In general, dispatchers can provide instructions that will help you. The dispatcher may also tell you how to help the person until someone with more advanced training arrives and takes over. The dispatcher may be able to tell you how to do CPR, use an AED, or give first aid. In an emergency, the sooner you realize that there's a problem and get help, the better it is for the ill or injured person. The next step in assessing the need for CPR is to check for breathing. When the person is unresponsive, scan the chest for 5 seconds, but no more than 10 seconds, checking for breathing. If the person is not breathing normally or is only gasping, they need CPR.
So do we know what gasping is?
Yes.
What?
Gasping is repeatedly trying to go for air without actually breathing.
Not repeatedly, like a sudden pause almost. Like a demonstration would be like trying. Not repeatedly would almost be kind of like an anxiety or a panic attack or something like that. But it would be like that actual sudden pause, like he's trying to find
breathing. If the person is not breathing normally or is only gasping, you need to begin CPR immediately. If the person is breathing normally and is unresponsive, place the person on their side until someone with more advanced training arrives. The video will now pause while you get in position to practice scene safety and assessment.
All right. So we're going to practice scene safety assessment, which is all those steps we just went over. You see a person fall. We'll do like a two-person. You guys are at the mall. You and him together are walking through the mall. Just came from the movies. Going to the food court. Y'all hungry. Y'all just finished the movie. So you see this person pass out. Both of you guys can stand up. I want you guys to switch spots. And just make it easier for when you tell Cameron to go and grab this AED. I want you to go take this over there so you can have some place to grab it from over there. So you see this person fall. What are you going to do first?
Are you okay?
Are you okay? So they don't respond. They don't respond. What are you going to do? No, not yet. You got to check for their breathing, right? And make sure. So you tap them. Are you okay? Are you okay? They're not answering you. They're not responding. So, no, you got to listen. So you look and see. You know when you breathe, your chest rise. You look and see. Scared. Just 5 or 10, not even, just quickly. You know, you don't have to stay in here for 10 minutes looking. And you can tell whether or not they're breathing. You can put your face closely, but not, super close and see if you can feel them breathing. So you see them fall. You're going to tap them and ask,
are you okay?
He doesn't respond. You're going to check for
breathing.
Okay. Put your face up to his mouth. Okay. No breathing. Now what?
You, Cameron, go get that AED and call 911.
Adult patient.
You don't.
If the patient is a child,
that's okay. We're
press
gonna just
the child button.
turn it off. Okay, so he's grabbed the AED. We're gonna leave this over here with you. And call 911. So 911, ringing. You talking to them, telling them you came through the mall, that you saw this patient and your brother's gonna start CPR. You'll have them on hold until somebody arrives. You don't have to demonstrate that. That's just how it's gonna be when you call them. And then that you guys just make sure nobody else is around you. You making sure the scene is safe at first, and then you can before you start CPR. But we're gonna learn how to do all these compressions and stuff like that. But now you're in position. He's grabbed the AED. He's called 911. Let's see. Oh, I gotta go to the next one. 1 second.
Before you provide CPR, check to make sure the scene is safe. Tap and shout to see if the person is responsive. Are you okay? Are you okay?
By safe,
if the person is unresponsive,
it would be like if they just fall in the mall. There might be some tables or something around. Move the chairs out, move the tables out so you can have enough space so the medical people can have enough space when they come in. If he fell in a pool of water or something, drag him out of the water, and that's how you'll provide the safety scene for them so that everybody else can work, including yourself. That's how you make sure that the scene is safe.
Okay.
Shout for help. Help! Help! I need help. If someone comes, have that person phone 911 and get an AED. You, call 911 and get an AED. Next, scan the chest for 5 to 10 seconds, checking for breathing. If the person is not breathing normally or is only gasping, you need to begin CPR immediately. If the person is breathing normally and is unresponsive, place the person on their side until someone with more advanced training arrives.
All right, let's demonstrate these chest compressions so we can put it all together soon.
Now, let's talk about chest compressions and hands-only CPR. Bystanders who are not trained in CPR are encouraged to provide compression-only CPR, also called hands-only CPR, if they see a teen or an adult collapse. There are 2 simple steps to follow. Phone 911 and push hard and fast in the center of the chest. High-quality CPR requires 2 main skills, providing compressions and giving breaths.
Remember in the beginning? Compressions and breaths,
are the most
CPR.
important part of CPR. We'll go over compressions first, and then we'll talk about breaths. A chest compression is the act of pushing on the chest. When you push down correctly on the chest, you pump blood to the brain and other organs. To perform high-quality compressions, you need to do 4 things. Provide compressions that are deep enough, provide compressions that are fast enough, allow the chest to return to its normal position after each compression, and don't interrupt compressions for more than 10 seconds. We're going to demonstrate chest compressions and then give you a chance to practice. When providing compressions, you're acting like the heart because in a cardiac arrest, it's not beating correctly on its own. By providing compressions, you're pumping blood to the brain and other vital organs, keeping them alive until advanced help arrives and the heart can begin beating on its own.
So just like the video said, when you do chest compressions, you're acting like somebody's heart, like you're taking the role of their heart. So when you put your hand on your heart, is it beating too fast? Is it beating too slow? It has a rhythm to it, right? Mm-hmm. So to stay on rhythm, you can sing like Staying Alive, that song, Staying Alive. Y'all know that song? You heard that song before? Yes. You can have that song, I'll sing it out loud for your camera. You can have that song in your head while you're pushing to stay on rhythm because you want the heart to stay on rhythm. You don't want to go too fast or go too slow because that's not what a normal rhythm does for a heart. You want to imitate being somebody's heart, so you have to be consistent.
Okay.
You need to push hard to a depth of at least 2 inches or 5 centimeters and push fast at a rate of 100 to 120 compressions per minute. Let's watch this demonstration. Then you'll get to practice. To provide chest compressions, first move the person to a firm, flat surface. Quickly move bulky clothes out of the way. If the person's clothes are difficult to remove, you can still provide compressions over their clothing. If an AED becomes available, remove all clothes that cover the chest. AED pads must not be placed over any clothing. It may seem awkward or uncomfortable removing someone's clothing, especially if you don't know them. But it's a necessary step to make sure the AED pads make direct contact with the skin. Remember, Good Samaritan laws protect people acting in good faith, so fear of legal repercussions shouldn't be a reason to not provide CPR. Place the heel of one hand in the center of the chest over the lower half of the breastbone, and put the other hand on top of the first. Next, push down hard, at least 2 inches or 5 centimeters. It's helpful to keep your elbows fully extended. If you're using a feedback device, your instructor will explain how your device works. When you reach the correct depth, you might hear a click or see a green light, depending on the mannequin you're using. In a real emergency, there won't be any feedback, and you'll have to estimate at least 2 inches or 5 centimeters. You should push hard and fast at a rate of 100 to 120 compressions per minute. Studies have shown that you're more likely to perform CPR at the correct rate if you're thinking about a song you know with a beat between 100 and 120 per minute. The Bee Gees song, Stayin' Alive, has a great name and is the correct rate for performing chest compressions. The American Heart Association website provides titles of additional songs that can help you give compressions at the correct rate. Finally, you need to allow the chest to come all the way back up after each compression. This is called recoil, and it's an important step that allows the heart to refill with blood. Our aim is to minimize interruptions in chest compressions to 10 seconds or less. This is true in all situations and for everyone, including pregnant women. Do not delay providing chest compressions for a pregnant woman in cardiac arrest. Provide high-quality CPR just as you would for any other adult. High-quality CPR can increase the mother's and the infant's chance of survival. The video will now pause while you get in position to practice chest compressions.
All right. You first. Get in position to practice chest compressions. Look at where your hand's going to go. Right below this nipple line here.
So I'm going to put this on.
Okay. All right. And remember, lock your elbows. And go ahead and try to, hold on. Go ahead and try to push. lock your elbows. So you put all your weight almost. Good. And I'm gonna sing the song to make sure you stay in rhythm. Stand alive, stand alive. Stand alive, stand alive. You're slowing down there. Stand alive, stand alive. Stand alive. Okay, good, good. I'm gonna put yours on the floor. You should grab a mat for your knees. What?
But he called for this.
To provide chest compressions, place the heel of one hand in the center of the chest
practice with them.
over the lower half of the breastbone, and put the other hand on top of the first. Next, push down hard, at least 2 inches or 5 centimeters. It's helpful to keep your elbows fully extended.
Right there.
You should push hard and fast at a rate of 100 to 120 compressions per minute. Finally, you need to allow the chest to come all the way back up after each compression.
Go, you don't have to pause. Get up on the mannequin. He's sliding. So, there we go. All right.
My turn?
Yep. But you got don't move your shoulders. There we go. No, listen. Stand alive. Stand alive. Stand alive. Stand alive.
I think the metronome from the video might help.
The what?
Finally, you need to allow the chest to come all the way back up after each compression.
Get ready, Cam. Watch the video.
Giving breaths.
Now, we're going to learn the second skill of providing high-quality CPR, giving breaths. Breaths are especially important for infants, children, and anyone in cardiac arrest due to choking, drowning, drug overdose, or any other respiratory cause. It's a common misconception that humans exhale only carbon dioxide, when in fact, we exhale a number of compounds, including oxygen. This means that the oxygen in your exhaled breaths is helpful to a person who can't breathe on their own. Before giving breaths, open the person's airway. Opening the airway correctly will help keep the tongue out of the way to make sure your breaths are effective. As you practice this skill today, you'll be using a mannequin.
Tilt head, chin lift. No, don't. Yep, just like that. Tilt head, don't touch his mouth. But we're not doing that right now. We're just practicing, just like you did. Tilt head, chin lift, just with 2 hands, just like you did. Put his head down. Do it again. Tilt head, chin lift. So tilt head first. What's on him? He dirty. Tilt head first, chin lift second. Tilt head, chin lift. You just 2 fingers. Okay. All right. Have a seat. Camera, you try. Tilt head, chin lift. Sorry, y'all. Tilt head, chin lift. Good. Okay.
It's important to note that in this upcoming demonstration, you'll see breaths given without a face shield or pocket mask. We'll cover giving breaths with a pocket mask in our next section. But for this practice session, your instructor will provide a face shield and mannequin sanitizing wipes. Face shields are relatively inexpensive barrier devices that are a great addition to any first aid kit. Watch this demonstration and then you'll get a chance to practice. Remember, you don't want to interrupt compressions for more than 10 seconds to give breaths. To open the airway, follow these steps. Put one hand on the mannequin's forehead and put the fingers of your other hand on the chin. Then, tilt the head back and lift the chin. This simple action lifts the tongue away from the back of the throat, opening the airway. It's important.
So what does the tilt head chin lift do?
It opens the airway and it moves the tongue.
Okay.
To avoid pressing into the soft area under the chin because this might block the airway. While holding the airway
So we're not
open,
giving the CPR
pinch the
mouth to
person's
mouth
nose closed
because of
with
COVID.
your
We're going
thumb
to
and
use
forefinger.
those
Take a normal breath.
ambu bags.
Cover the
Okay.
mannequin's mouth with your mouth. Give 2 breaths. Blow for 1 second for each breath. As you give each breath, you should look down at the mannequin's chest to see it rise. Actually seeing the chest begin to rise is the best way to know that your breaths are effective. Remember, if you give someone a breath and the chest doesn't rise, allow the head to go back to its normal position. Then, open the airway again by tilting the head back and lifting the chin. Give another breath, making sure the chest rises.
So if you don't see the chest rise when you're giving mouth to mouth or with the ambu bag, what are you going to do?
If you're gonna reset their head back
Yep.
to the normal position.
You got it, Cam?
Don't interrupt compressions for more than 10 seconds to give 2 breaths. The video will now pause while you get in position to practice giving breaths.
I'm going to skip that part. And we're going to go to the face mask.
You may give breaths with or without a face shield or pocket mask. If you're in the workplace, your employer may provide this kind of personal protective equipment for use during CPR. Many first aid kits also contain these supplies. There are different kinds of face shields and pocket masks, and there are different sizes for adults, children, and infants. So make sure you're using the right size. Pocket masks and face shields are made of plastic and fit over the person's mouth or mouth and nose. Face shields are a thin piece of flexible plastic meant to be a one-time use barrier between you and a mannequin or you and another person. Make sure that the face shield is pulled securely over the mouth and deliver breaths just as you would from mouth to mouth. Pocket masks are reusable barrier devices that can be sanitized between use. They're typically made of hard plastic with a one-way valve, and they protect the rescuer from coming in contact.
Why would you want a one-way valve? Like, what do you think a one-way valve means?
If you have a one-way valve, that would mean that there would probably only be one opening, and because there's one opening, that means that the air would stay enclosed into the person's mouth and nose.
Right, so why would you want a one-way valve?
Because you wouldn't want the air to escape.
Or if they vomit, to
Yes.
come back out towards you.
Blood, vomit, and contagious disease. The one-way valve is the part you breathe into. A pocket mask may not be included in a typical first aid kit, but the AHA recommends that you add it. You may need to put a pocket mask together before you use it, but this is usually as simple as popping it into.
These things, the little pocket masks, they could be sold separately. That way you don't have to worry about giving mouth to mouth directly to somebody if you need to.
Okay.
So just like you would buy, anything else, you can buy something like this and have it on the keychain.
Okay.
Shape and connecting the two pieces. And by the way, use the one-way valve you are given for today's practice only, and then discard it. So, let's take a look at how to give breaths with a mask. We're going to show you a demonstration on how to place the mask and give breaths. Afterward, we'll give you a chance to practice giving breaths with the mask. Start out kneeling next to the mannequin. Put the mask over the mannequin's mouth and nose. If the mask has a narrow or pointed end, put that part of the mask on the bridge of the nose, and the wide part of the mask should cover the mannequin's mouth. Tilt the head back and lift the chin while pressing the mask against the mannequin's face. It's important to make a good seal between the mannequin's face and the mask while you lift the chin to keep the airway open. Now that you've got the mask positioned, give 2 breaths while watching for the chest to rise.
So I don't even, let me see my packet. Hold on, because technically you need a valve there. So this is going to be like, this is going to be your breath for you.
Okay.
Because I got to get some of those pieces. That's for a kid. All right, so you just demonstrated just like that. The 2 breaths. When he gives 2 breaths,
You want me to stand up?
you
Or
push
sit
the
down?
bag. 2 breaths.
You want me to stand up or sit down?
You can watch him if you got to stand up to see him do it, to demonstrate it.
As you give each breath, you should look down at the mannequin's chest to see it rise. Actually seeing the chest begin to rise is the best way to know that your breaths are effective.
You see how his fingers are here with that C
If you give a
seal?
breath and the chest doesn't rise, you need to reopen the airway and reposition the mask to get a better seal. Give another breath and make sure the chest rises.
Put that on his face first and then
Interrupting
head
compressions for
tip.
no more than
Okay.
10 seconds total. If the chest doesn't rise, begin pushing hard and fast.
So you got to
on the
work,
chest
yep.
again.
Put him, work with
Now
one
we're
hand,
going
just
to
like
practice
that.
using a mask to give breaths. The video will pause so you can
So
put your mask
it's
together
easier
and
for you
get
to
into
do it sideways with a C. Like, let me go around this side. Just scoot down a little bit because you're going to need to do this. So it's easier for you to come up underneath here. So put the C here, and then you can lift with your other fingers, and that way you can hold this still at the same time.
Okay.
And then you push. You got to make sure that seal is in there. Make sure no air is escaping from the bottom
Will
half.
his chest move?
I think it should go up and down. Can you feel it?
Slightly.
But just try to see from the side so that way you have enough.
Mm-hmm.
No, I'm talking about you.
Oh.
You try to see with your fingers. That's what it's called, and then use them last couple fingers to hold the head in place, and then press it. Don't push my
Is that
phone.
how you do it?
Yeah, that is.
I don't push it.
Yeah, because I need to buy some valves to put in there.
Mm.
This ain't nobody else's using them, but it's okay.
Are you gonna keep this in?
I was about to say, is that a little awkward? You wanna? Why don't you use the C with your left hand and see if that'll work better?
Okay.
Better positioning. Other way, the narrow part goes at the top. Look at the mask. Yep, the narrow part goes at the top. You gotta tilt his head though.
Put the mask over the mannequin's mouth and nose. Tilt the head back and lift the chin while pressing the mask against the mannequin's face. Now that you've got the mask positioned, give 2 breaths
You
while
give 2
watching
breaths
for
with the
chest
ambu
to
bag.
rise.
All right. So the next thing we're gonna do is the AED. We're almost finished. All right, have a seat so we can learn
By
about this
now,
AED.
you've learned how to provide compressions and give breaths with and without a mask. Let's look more closely at using an AED. An AED is a device that can deliver a shock to the heart of a person in cardiac arrest if needed. Even though you may be in the midst of providing CPR, once the
Pay
AED
attention to
arrives, use it immediately. CPR combined with using an AED provides the best chance of saving a life. If possible, use an AED every time you provide CPR. During cardiac arrest,
You
the
see those
heart quivers
placements?
and stops pumping blood.
It's right on the picture
An
for the
AED
AED.
shocks the heart so that the heart's rhythm can reset and the heart can.
What's the AED do?
Shocks.
It shocks the heart
So
so,
that
that the
the-
blood can pump again.
So that the rhythm.
Or so the heart can
Pump
pump
blood
blood
again.
again.
Mm-hmm.
To use an AED, you simply turn it on by either pushing the on button or lifting the lid. Once you turn on the AED, you'll hear prompts telling you everything you need to do. AEDs may have 2 sets of pads, a large set to use for adults and a small set to use for children. Make sure you use the large pads on anyone 8 years of age or older. Later, we'll talk about using the smaller pads for children younger than 8 years old. You may have already moved some of the person's clothes out of the way to perform CPR, but you should remove all clothes that cover the chest before using an AED. AED pads must not be placed over any clothing. It's important that the AED pads not touch anything other than the person's bare skin. Peel away the backing from the pads and attach them to the person. Follow the pictures on the pads. You don't need to remove a person's jewelry as long as it doesn't interfere with the placement of the pads and isn't in contact with the pads. It doesn't cause a shock hazard to either the person being helped or the rescuer. However, undergarments should be removed, along with other clothes covering the chest, since they often interfere with proper pad placement. Plug the pads connector into the AED and follow the AED prompts. Make sure no one is touching the person while the AED analyzes the heart rhythm and before you push the shock button.
So before you push this shock button on the AED, what do you need to make sure?
Nobody's touching it.
That's right, nobody's touching it.
AED
And then before you
recommends a
use the
shock.
AED, what do you got to do?
Press the shock button.
Turn it on. You don't press the shock button.
Or
You turn it on, and you let the AED tell you what to do. Don't do anything before it tells you to do it.
And if it says press the shock button,
Then you do whatever it says.
Okay.
Will tell you to stay clear or not touch the person. If the AED tells you not to touch the person, look to be sure that no one is touching the person, including you. Shock. Immediately resume chest compressions. After this demonstration, you'll have a chance to practice using an AED trainer so that you can see what it's like. You'll need to consider a few special situations when using an AED. First, if the person has hair on their chest, the hair may prevent the pads from sticking. If your AED has only one set of pads, a razor should be included. You can use the razor to quickly shave the area and then apply the pads. If your AED has 2 sets of large pads, you can try this. Apply 1 set to the hairy chest, and if the hair prevents the pads from coming in contact with the chest, the AED should tell you to check the pads. If it does, press the pads down more firmly. If they still aren't sticking, rip the pads off forcefully, removing the chest hair. Then, reapply a new set of pads to the bare skin. Water on a person's chest can also be a problem. It could allow the shock to travel through the water between the pads, ultimately preventing delivery of an effective shock dose to the person's heart. If someone is lying in water, you should quickly move them to a dry area. However, if the person is lying in snow or in a small puddle, you may use the AED. And if the chest is covered with water or sweat, wipe the chest before attaching the AED pads.
So if the person's chest has water on it, can you use the AED?
No.
No.
Not until you wipe it. But if the person is lying in snow or maybe a pool of water,
Yes.
can you use the AED?
Yes.
Okay.
Quickly. It doesn't have to be completely dry. Some people have an implanted pacemaker or defibrillator in the same place where you would put the AED pads. These devices look like a round or square lump smaller than a deck of cards. If you see this lump, avoid putting the pads directly over it. Also, don't place the pad directly over a medicine patch. If a medicine patch is located where you need to place a pad, take the patch off and quickly wipe the chest before you put on the pad. If you're not wearing gloves, make sure you don't touch the underside of the patch. You don't want to get any of the medicine on your bare skin. Use an AED for a pregnant woman in cardiac arrest just as you would for any other person. If your workplace has an AED, you should familiarize yourself with it. Regardless of the type of AED, remember...
DJ, do you know where the AED is at your job?
It is located in the staff room.
It's not out in the open?
Oh no, sorry, the fire extinguisher is located in the staff room.
They both should be out in the open. But in enclosed, like, windows or doors.
It's like there is no door
Okay.
in the staff room. Like it's just a whole empty doorway.
But you got to get into the staff room, right? That stuff need to
Yeah.
be easily accessible.
Remember to turn it on first and follow the audible prompts that will lead you to the steps.
You know, I think there's another.
Additional
fire
emergency
extinguisher
equipment
across
may be found in
the
the
library.
AED, such as scissors, razors, wipes, gloves, and a barrier device. These items may also be found in a separate emergency or first aid kit. The video will now pause to allow your instructor to lead a practice session with an AED trainer. These trainers simulate what a real AED would do, but they
All right, Cameron, I want you to go grab the AED.
won't provide a shock.
Okay, that's the scenario. If he's telling you go grab the AED, he's still doing compressions. Turn the AED on and listen to what it tells you to do.
Adult patient. If the patient is a child, press the child button. Remove clothing from the patient's chest.
Listen to it, Cameron.
Remove packet and apply pads onto patient's bare skin.
Remove packet and apply the pads for
Apply
patient's bare
pads
skin.
as shown in the pictures.
Apply the pads as shown on the picture. Where's that pad going?
Remove packet and apply pads onto patient's bare
Okay,
skin.
come on.
Apply pads as shown in the pictures.
You can put it sideways. That's
press
fine, though. That's
pads
fine.
firmly on skin.
And just press it firmly. Make sure it stays on there.
Apply
Now
pads
put the
as
other one on
shown
them.
in the pictures.
Start on the bottom. You see it's a little latch on the
Apply
bottom.
pads as shown in
See
the
right here?
pictures. Press pads firmly on skin. Apply pads as
here, you
shown
see the
in the
picture?
pictures. Press pads firmly on skin.
Just put it a little bit up here.
Do not touch
Okay.
the patient.
Don't
Analyzing
touch the
heart
patient.
rhythm.
Analyze the patient. That's when you go clear, all clear.
Do
Nobody
not
touches.
touch
Just put
the
your hands up.
patient. Analyzing
the
heart
heart.
rhythm.
Let him do his thing.
Shock advised.
Press the shock button.
Do not touch the patient. Everyone clear. Press the flashing shock button. Shock delivered. Begin CPR. Ten.
And then
20.
that's when you do this. Keep going.
30. Give 2 breaths.
Give you 2 breaths. Boy, thank you. You're going too fast. You gotta do it right. Do CPR.
10.
And Cameron, you could probably come up here and you can give the breaths for him.
20.
Not yet. Don't
30.
press it yet.
Give 2
Just tell-
breaths.
Press, no, DeAndre, you good. Press it, Cameron. Okay, go ahead, DJ.
10. 20. 30. Give 2 breaths.
Good. So they're doing 30 compressions and 2 breaths, and they do it continuously until we do 100.
10.
15. Don't press it again.
20. 30. Give 2 breaths.
Okay. I was just gonna pause.
10.
Go ahead, get down there so you can get ready to do his breath. See if it'll prompt you again. If it's chin up with it. Okay.
30. Give 2 breaths.
If it's chin up. Okay. Turn that off, DJ.
Stop CPR. Do not touch the patient.
Oh.
Analyzing heart rhythm. Do not touch the patient. Analyzing heart rhythm. Shock advised. Do not touch the patient. Everyone clear.
All right, go ahead and turn
Press
it.
the flashing shock button. Shock delivered. Begin CPR.
You can turn the AD off. Hold it. All right. That was our practice putting it all together. And look at this video. You can demonstrate as you do the
Now
video.
we're
Go ahead and
going
take
to
those off.
demonstrate
Put it back
how
on
to
the
put it
thing.
all together. From
When they demonstrate it, I want you guys to follow the demonstration. Put that one on the back side, Cam. The back side of what DJ has.
pain safety and assessment, to providing compressions and giving breaths, to using an AED. Afterward, you'll get a chance to practice. First, check to make sure the scene is safe.
We're going to have to
Tap
put it all
and shout
together.
to see if the person is responsive.
Look,
Are you
put it all
okay?
together.
Are you okay?
If the person is unresponsive, shout for help.
Help! Help!
Ask someone to phone 911 and get an AED.
Phone 911 and get an AED.
Next, scan the chest for 5 to 10 seconds, checking for breathing. If the person is not breathing normally or is only gasping, provide CPR. Make sure the person is lying on their back on a firm, flat surface. Quickly move bulky clothes out of the way. If a person's clothes are difficult to remove, you can still provide compressions over clothing. If an AED becomes available, remove all clothes that cover the chest. AED pads must not be placed over any clothing. Now, tilt the head back and lift the chin to open the airway. Give 2 breaths. Remember, do not interrupt compressions for more than 10 seconds. Give another set of 30 chest compressions. Now, tilt the head back and lift the chin. Give 2 breaths. Once the AED arrives, use it immediately. First, turn on the AED by pushing the on button or opening the lid. Attach the pads to the person's bare chest. Follow the AED prompts and the pictures on the package or pads. Plug in the pads connector. Make sure no one is touching the person while the AED analyzes the heart rhythm and before you push the shock button. Press the
Cameron,
shock
go
button
take that
if
AED
the
over
AED
there.
says to, and
You want me
immediately
to put his
resume
jacket back
CPR.
on?
Starting with
No,
compression.
it's okay.
Now the video will pause and your instructor will help you practice putting it all together.
All right. Mall, and you see somebody, you know, pass out in the food court, and what are you gonna do? First, you're gonna make sure that the scene is safe, and say it out loud so I can make sure. No, you say scene is safe before you start this, so I know that you are doing the right thing.
Okay. Scene is safe.
Okay.
Hey, are you okay?
Check for those breaths.
You call 911 and go find me an AED.
Cameron, you can turn it on.
Adult patient.
DeAndre, you need to take his jacket
The
off.
child, press the child button. Apply pads as shown in the pictures. Apply pads
He needs to apply the
as shown
pads.
in the
And
pictures.
DJ, you need to be doing his breaths.
Press
You
pads
keep listening for
firmly
air
on
each
skin.
time. When you start CPR, you do the compressions
Apply
and the
pads
breaths.
as shown in the pictures. Apply pads as shown in the pictures. Press pads firmly on skin. Do not touch the patient. Analyzing heart rhythm.
Good job, Cam.
Do not touch the patient. Analyzing heart rhythm. Shock advised.
Clear, all
Do
clear.
not
Don't
the
touch.
patient. Everyone clear.
Everyone
Press
clear.
the flashing shock button.
Press the button.
Shock delivered. Begin CPR. 10.
Good job, Kim. Lift his chin. Not yet. Don't get a breath yet, but lift his chin.
30. Give 2 breaths.
DeAndre, let him do it. You got a partner.
Ten. 20. 30. Give 2 breaths.
Lift his chin up. Make sure he getting them whole breaths. There you go.
Give 2 breaths. 10. 20. 30. Give 2 breaths.
It can be tiring to keep up the pace. Therefore, if someone else at the scene knows CPR, take turns providing CPR by switching at least every 2 minutes, even if you're not tired. As you help each other and take turns providing CPR, it's important to give each other feedback. While you're resting, remind the other rescuer to push down at least 2 inches or 5 centimeters at a rate of 100 to 120 compressions per minute, and to let the chest come back up to its normal position after each compression. You've just practiced life-saving CPR and AED use for adults. The video will now pause for your instructor to test you on these skills.
So there is a test, afterwards. It's a multiple choice test, a written one, and then you got to perform it on your own where I don't help you at all. I just critique you do it.
Okay.
Choking in adults is often caused by food blocking the airway.
That's that
The block in
universal
the airway
sign.
may be mild or
Somebody
severe.
choking.
We've all been in a situation where food or drink gets caught in our throat, making it difficult to swallow or even breathe for a few seconds. These situations are called mild airway blocks and are normally relieved without intervention. If a block is mild, a person can make sounds and cough loudly. When this happens, you may want to help, but it's best to stand by and let the person cough. If you're worried about the person's breathing, phone 911. If the block in the airway is severe, then the person cannot breathe, talk, or make sounds. The person may also make the choking sign by holding their throat. If this happens, you need to act right away to try to clear the airway. To help in this situation, you will give abdominal thrusts slightly above the navel. Each thrust
You see where she's pushing? You
pushes
got the one
air
hand,
from
but
the lungs
right above the belly
This
button.
can help remove an object blocking the airway. If you think a person might have a severe airway block, follow these steps. Ask if the person is choking and if you can help.
Are you choking? Can I help you?
If the person nods that they are choking and can't talk, you need to act. You'll need to give thrusts slightly above the navel. Depending on your size and the size of the person choking, stand firmly or kneel behind the person and wrap your arms around their waist with your fists in front. Make sure to position yourself so that you are stable in case the person collapses to the ground. Some people find it helpful to stand with their feet shoulder width apart and one leg slightly forward. This creates more stability. Make a fist with one hand. Put the thumb side of your fist slightly above the navel and well below the breastbone. Grasp your fists with your other hand and give quick upward thrusts into the abdomen. Give thrusts until the object is forced out and the person can breathe, cough, or speak. An adult who has been given thrusts should see a healthcare provider as soon as possible. Let's look one more time at how to make a fist. Make a fist with one hand. Put the thumb side of your fist slightly above the navel and well below the breastbone. Grasp your fist with your other hand and give quick upward thrusts into the abdomen. If the person is pregnant or very
So that
large,
angle kinda-
you will need to change how you relieve choking.
Yeah.
Put your arms under the person's armpits and your hands on the lower half of the breastbone. Pull straight back to give chest thrusts instead of abdominal thrusts. You can also use this technique for someone in a wheelchair. If you give someone thrusts but cannot remove the object blocking the airway, the person will become unresponsive. In this case, you need to give CPR.
Understand? So if someone's choking originally and your thrusts are not working, that they haven't expelled this object and they stop breathing, then
We give CPR.
you got to give CPR. Because now at this point they stop breathing.
But there are a few differences. First, you'll need to get the person safely onto a firm, flat surface. This can be challenging, especially if the person is much larger than you. The best technique is to slowly walk backwards and allow the person to slide toward the floor until they're flat on their back. As you've already learned, when a person becomes unresponsive, shout for help. Phone or have someone else phone 911 and get an AED if they haven't already. Put the phone on speaker mode so that you can talk to the dispatcher. Provide CPR, starting with compressions. After 30 compressions, you will do something a little different from what you were taught earlier. Open the airway and quickly look in the mouth. If you see an object in the mouth, take it out. Do not attempt to reach in and pull anything out that you can't clearly see. This is known as a blind finger sweep. Doing a blind finger sweep may cause the object to become lodged farther back in the airway. Remember, you want to minimize interruptions in compressions to no more than 10 seconds. After checking the mouth, give 2 breaths. Keep repeating the sets of 30 compressions and 2 breaths.
So almost the same thing, but adding that step to look and see if you see that object that you tried to get out originally. Okay?
Each time you open the airway to give breaths, look for the object in the back of the throat if you haven't already found it. Continue CPR until the person speaks, breathes, or moves, or until someone with more advanced training arrives and takes over. Drowning and related injuries are a big problem, especially for children. This wraps up our Heart Saver CPR AED course. By taking this course and stepping up to help when someone needs CPR or choking relief, you are increasing that person's chance.
So I want you to demonstrate on camera, but don't do it. Just put yourself in position to do it, but don't do it. And then Cameron, I want you to demonstrate on DeAndre. Just put yourself in position to do it, but don't do it. DeAndre,
I'm taller than him. What does that mean?
I know, but sometimes
he's way bigger than me.
It's okay. So you can still help is what I'm saying, even though you're small. So you demonstrate on him and make your thumb fist and do it. Don't do it, just demonstrate. Let me see your thumb. Okay. Is it above his belly button?
Mm-hmm.
Okay. And then you don't do it for real, but when you do it, you gotta go up like this. Okay?
I can do it.
Okay, now let's switch spots.
Okay. Oh wait.
Come on, you could have just turned around. Do it right here. Okay, Cameron, let me see your fist, thumb side, like this, underneath his. Okay, you got it? And then hold that, and you be up. Yep, just like that. So you're not too small. It'll come out. You just got to do it with all your might, okay?
I can do it.
I was gonna hurt him.
No, please don't hurt him.
Why?
All right, let me take a look here. You can press pause, Deej.
Okay.
Let me things. So with the adult rescuer, you got you by yourself, or you got a 2 rescuer. If you by yourself, DJ, just tell me what you're gonna do. If you're by yourself and you see somebody fall, you're gonna make sure the scene is safe, and then you're gonna ask the patient
if they are okay, and I will determine if they're responsive.
Okay.
If they are unresponsive, then that's when I'll begin. That's when I'll check for breathing.
Uh-huh.
And if I can't hear any breathing and I can't feel any breathing, that is when I begin CPR.
So you by yourself. So before you start CPR, I want you to call 911 because you're not going to have anybody to do that. Call 911 first.
Okay.
And then try to find an AED first before you start chest compressions because you don't want those to be interrupted. So if you got somebody with you, which was a 2-person rescuer, like Cameron, you wouldn't have to do that first step because you're going to tell him to do what?
Call 911 and find an AED.
Right, and then you're going to start those chest compressions. And then Cameron, while he's doing those chest compressions, you will get that AED ready and listen to everything that they say. And then you just take over doing breaths. Or you guys can switch and take over doing those chest compressions so he won't get tired. Okay? So you got to check the scene. You tap and ask him if he's okay. Y'all start those chest compressions. 2 hands in the center of the chest, the lower half of the breastbone, which is like right below the nipples. And you got to go at least how many inches?
2.
You got to go at least 2 inches. And you got to do how many compressions?
30.
Yep.
In a sets.
Yep, that's right. That's right. And then when you open the airway, how many breaths are you giving?
2.
Good. And then Cameron, what are you doing with the head?
Look, the chin.
Yep, you tilt head, chin, lift chin. Good job. All right, let's see. With the 2-person, same thing. And then we said, what about the safety? If it's water on their chest?
Wipe
Wipe
it
it
off. Move them to a dry area and then proceed to wipe it off.
Okay, but it's okay for you to give the AED once you wipe the chest, and it's also okay to give the AED if
they're in snow or a puddle.
Right, as long as water's not on their chest. What if they have that defibrillate? I mean, not the defibrillate, the pacemaker, which is an implant. Then you
move around it.
Yep, you don't put it over top of it. And if they're hairy,
then you either use a razor or you place it firmly and tear it off.
Rip it off. That's gotta hurt, but you know. And what if you do a CPR and you hear a crack, like you broke their ribs? So we went over this. Do you keep going or do you stop?
You keep going.
That's right, because I'd rather have broken ribs than to be gone.
Than to be dead.
And then once the 911 send the dispatch to send some people out, you just continue CPR until they take over. Don't stop CPR because you want them to live. You want to have to done all this work for nothing.
Okay. And what if the AED says to stop?
Then you listen to the AED, but the AED is not going to tell you to stop. The AED is going to make you keep going rounds until that person comes back alive. So the AED is going to continue to analyze. Because that's the AED's job.
Moving or breathing, that's when you.
But when the AED is going to pick that up, and they'll know. So they'll probably tell you to stop. And Cameron, before you press that shock button, you're making sure what?
Nobody is touching it.
All clear, right?
Yeah.
They have a medicine patch.
If they have a medicine patch, you also you need to move it out the way, wipe it.
Yep. And make sure that you don't touch
any
it.
Medicine on you.
What if they have their body jewelry on?
It's you usually don't have to do anything to it unless it's obstructing the pads.
Okay. No, we already went over the device. Good.
I knew that, but I didn't know how to say it.
That's okay. As long as you know what to do.
Arrest, but it certainly happens. Pediatric cardiac arrest isn't as common as adult cardiac arrest. In adults, the cause of cardiac arrest is often cardiac related, but in children and infants, cardiac arrest is often due to respiratory problems, such as airway obstruction, drowning, opioid overdose, or seizures.
There are some differences in BLS for children, including the chains of survival. Like the adult chains of survival, the pediatric chains have 6 links. Both pediatric chains include prevention of cardiac arrest, activation of the emergency response system, high-quality CPR, advanced resuscitation, post-cardiac arrest care, and recovery. In a hospital setting, the difference is the first link. It focuses on early recognition and prevention of cardiac arrest, which emphasizes patient monitoring and assessment.
Before we get to the practice, let's talk about a few important differences between BLS for children and BLS for adults. First, under the AHA BLS guidelines, anyone from age 1 year old to puberty is considered a child.
So how old for a child?
1 year old to puberty, which is about 16, 17.
I probably want to say about 14, 15.
Or is it when it ends or it starts?
I want to say about, I don't know when it ends or it starts. I want to say about 14 or 15. Then it's about adult CPR. And the difference is the depth that you're doing for those compressions. Right. But sometimes you got bigger kids, so you need to give adult CPR. So we got to do adult, child, and infant. So infant obviously will be under 1 because a child is from 1 to puberty.
Under these guidelines, puberty is defined as chest or underarm hair on boys and any breast development on girls. When you're performing compressions on a child, it's fine to use 1 or 2 hands, whichever works for you and allows you to provide deep, effective compressions.
To be effective, your compressions must go to a depth of at least 1/3 the depth of the child's chest. That's approximately 2 inches or 5 centimeters.
So what was the depth for adults?
2 inches.
And what's the depth for a child?
2 inches.
And the chest must recoil completely between compressions. Also, whether the victim is a child or an adult, a single rescuer always uses a compression to ventilation ratio of 30 compressions to 2 breaths. However, if you're a 2 rescuer team and the victim is a child, the ratio changes and should be 15 compressions to 2 breaths.
So you see the difference?
Yeah.
Mm-hmm.
So it's 30 to 2 always with single or a partner. But for a child, it's 30 to 2 if you're single. But for a partner,
15.
okay.
It's important to note that giving breaths to children requires less volume and force than giving breaths to adults. Breaths that are too large or forceful have greater potential to cause lung trauma in children than in adults. However, you still need to provide enough air to see the chest rise.
Another difference is when to activate the emergency response system. If you do not witness the arrest and you're alone, you should perform 5 cycles of CPR to deliver oxygenated blood to the victim's brain before you activate the emergency response system. If the child has an adequate pulse but is not breathing normally, it may be due to a respiratory problem, so you must provide rescue breaths. Deliver 1 breath every 2 to 3 seconds or 20 to 30 breaths per minute.
If you are alone and witness a sudden arrest, leave the child so that you can activate the emergency response system and get the AED. Then return to the child to perform CPR and use the AED.
Now, let's combine the BLS skills that you've learned for adults with the differences we just reviewed to practice BLS for children. For this session, we'll practice 2 rescuer child CPR by using a 15 to 2 compression to ventilation ratio. One person will provide compressions while the other delivers breaths with a bag mask device. We'll pause here while everyone gets into position.
So it's basically the same thing.
Yeah. But 15, right? Same thing, but 15 because you guys got 2 people. Go ahead, go up there.
Put this up.
That's an infant. We're going to use this adult as a child.
So press the baby.
We are?
Press the baby when it asses.
No, this is an infant.
Oh,
We're
no.
going to use him as the child.
Press the baby when it asses.
No.
Oh, just press it.
We don't need
I
that.
could have sworn it was like this, but it's really like this.
Yes. Yes.
I always thought it was like this.
As long as you get right in where underneath that breastbone where you need to be, it really doesn't matter how exactly your hands are positioned.
So I just gotta do.
He gonna do 15, 2 breaths, 15, 2 breaths, same thing. You make sure that head is tilted, that chin is up.
Will we use the AED?
No.
Okay. Cool. Put the thing over. Okay. 3.
Hold on. I'm trying to...
Keep his chin up.
You keep the chin up.
Press enter.
So let's count down to compressions and get started with 2 rescuer CPR for children, starting with scene assessment. To stay together, follow the prompts on the screen.
Follow the prompts on the screen.
3, 2, 1.
Hey, are you okay?
Are you okay?
Activate
Are
the
you
emergency
okay?
response and get an AED.
Get an AED.
There's no breathing, no pulse. 1, 2, 3, 4,
Yep.
5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Good job, Cameron.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
A little slower, DJ, but you're doing good. Go ahead.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Good job. Good
I thought I had to use the hand. It literally said it.
Well, he was telling you to grab it, you know, just in case. He's telling you to grab it.
Is that it for the... All right, we still got to do the infant.
Here's a fact about cardiac arrest. Between 75 and 80% of all out-of-hospital cardiac arrests happen at home. So being trained to perform CPR, whatever your profession, can be the difference in saving a loved one. And we never know who a victim might be. Cardiac arrest can occur in anyone, regardless of their age or perceived health.
Rescuing an infant can feel completely different from rescuing an adult, but the principles of CPR for infants who are younger than 1 year old are essentially the same as for adults. There are just a few differences, but those differences are significant.
So let's take things in the same order we used for adult CPR. Right now, we'll talk about the skills for 1 rescuer and 2 rescuer infant CPR. But this time, we'll first learn to check for a brachial pulse. Then we'll cover infant compressions, followed by giving breaths with a bag mask device.
So we're doing the baby now. And the brachial is here. So they're asking that we check for the brachial pulse before we start for those infant compressions.
Okay.
Before we start for those infant compressions.
Is it on the underside or the overside of your arm?
And the inside.
Underside, okay.
Finally, we'll combine all of these to practice 2 rescuer infant CPR.
First, if the cardiac arrest is witnessed, check the infant for a response and breathing. If the infant is unresponsive and isn't breathing or is only gasping, send someone to activate the emergency response system and get an AED. If you're alone and don't have a mobile phone, take the infant with you to phone emergency services. Or, if necessary, leave the infant and find a phone. But if no one witnessed the infant's collapse and there's no response or breathing, check for a brachial pulse immediately. If you do not detect a pulse, perform...
Where's the brachial pulse?
Right here.
Okay, on either arm.
Okay.
2 minutes of compressions and breathing before activating emergency response, if it hasn't already been activated.
If an infant has an adequate pulse but isn't breathing normally, rescue breaths may be required. Deliver 1 breath every 2 to 3 seconds,
see those pads,
which
Cameron?
is about 20 to 30 breaths per minute.
1 on the front, 1 on the back, because
To
it's a
check an
baby.
infant's brachial pulse, first place 2 or 3 fingers on the inside of the upper arm, between the elbow and shoulder.
Imagine a child being a victim of cardiac arrest, but it certainly happens. Pediatric cardiac arrest isn't as common as adult cardiac arrest. In adults, the cause of cardiac arrest is often cardiac related, but in children and infants, cardiac arrest is often due to respiratory problems, such as airway obstruction, drowning, opioid overdose, or seizures.
There are some differences in BLS for children, including the chains of survival. Like the adult chains of survival, the pediatric chains have 6 links. Both pediatric chains include prevention of cardiac arrest, activation of the emergency response system, high-quality CPR, advanced resuscitation, post-cardiac arrest care, and recovery. In a hospital setting, the difference is the first link. It focuses on early recognition and prevention of cardiac arrest, which emphasizes patient monitoring and assessment.
Before we get to the practice, let's talk about a few important differences between BLS for children and BLS for adults. First, under the AHA BLS guidelines, anyone from age 1 year old to puberty is considered a child.
So how old for a child?
1 year old to puberty, which is about 16, 17.
I probably want to say about 14, 15.
Or is it when it ends or it start?
I want to say about, I don't know when it ends or it starts. I want to say about 14 or 15. Then it's about adult CPR. And the difference is the depth that you're doing for those compressions.
Right.
But sometimes you got bigger kids, so you need to give adult CPR. So we got to do adult, child, and infant. So infant obviously will be under 1 because a child is from 1 to puberty.
Space.
Under these guidelines, puberty is defined as chest or underarm hair on boys and any breast development on girls. When you're performing compressions on a child, it's fine to use 1 or 2 hands, whichever works for you and allows you to provide deep, effective compressions.
To be effective, your compressions must go to a depth of at least 1/3 the depth of the child's chest. That's approximately 2 inches or 5 centimeters.
So what was the depth for adults?
2 inches.
And what's the depth for a child?
2 inches.
And the chest must recoil completely between compressions. Also, whether the victim is a child or an adult, a single rescuer always uses a compression to ventilation ratio of 30 compressions to 2 breaths. However, if you're a 2 rescuer team and the victim is a child, the ratio changes and should be 15 compressions to 2 breaths.
So you see the difference?
Yeah.
Mm-hmm.
So it's 30 to 2 always with single or a partner. But for a child, it's 30 to 2 if you're single. But for a partner,
15.
okay.
It's important to note that giving breaths to children requires less volume and force than giving breaths to adults. Breaths that are too large or forceful have greater potential to cause lung trauma in children than in adults. However, you still need to provide enough air to see the chest rise.
Another difference is when to activate the emergency response system. If you do not witness the arrest and you're alone, you should perform 5 cycles of CPR to deliver oxygenated blood to the victim's brain before you activate the emergency response system. If the child has an adequate pulse but is not breathing normally, it may be due to a respiratory problem, so you must provide rescue breaths. Deliver 1 breath every 2 to 3 seconds or 20 to 30 breaths per minute.
If you are alone and witness a sudden arrest, leave the child so that you can activate the emergency response system and get the AED. Then return to the child to perform CPR and use the AED.
Now, let's combine the BLS skills that you've learned for adults with the differences we just reviewed to practice BLS for children. For this session, we'll practice 2 rescuer child CPR by using a 15 to 2 compression to ventilation ratio. One person will provide compressions while the other delivers breaths with a bag mask device. We'll pause here while everyone gets into position.
So it's basically the same thing.
Yeah. But 15, right? Same thing, but 15 because you guys got 2 people. Go ahead, go up there.
Put this up.
That's an infant. We're going to use this adult as a child.
So press the baby.
We are?
Press the baby when it asks.
No, this is an infant.
Oh,
We're
no.
going to use him as the child.
Press the baby when it asks.
No.
Oh, just press it.
We don't need that.
I could have sworn it was like this, but it's really like this.
Yes. Yes.
I always thought it was like this.
As long as you get right in where underneath that breastbone where you need to be, it really doesn't matter how exactly your hands are positioned.
So I just gotta do.
He gonna do 15, 2 breaths, 15, 2 breaths, same thing. You make sure that head is tilted, that chin is up.
Will we use the AED?
No.
Okay.
So let's count down to compressions and get started with 2 rescuer CPR for children, starting with scene assessment. To stay together, follow the prompts on the screen.
Follow the prompts on the screen.
3, 2, 1.
Hey, are you okay?
Are you okay?
Activate
Are
the
you
emergency
okay?
response and get an AED.
Get an AED.
There's no breathing, no pulse. 1, 2, 3, 4,
Yep.
5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Good job, Cameron.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
A little slower, DJ, but you're doing good. Go ahead.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Good job.
Here's a fact about cardiac arrest. Between 75 and 80% of all out-of-hospital cardiac arrests happen at home. So being trained to perform CPR, whatever your profession, can be the difference in saving a loved one. And we never know who a victim might be. Cardiac arrest can occur in anyone, regardless of their age or perceived health.
Rescuing an infant can feel completely different from rescuing an adult, but the principles of CPR for infants who are younger than 1 year old are essentially the same as for adults. There are just a few differences, but those differences are significant.
So let's take things in the same order we used for adult CPR. Right now, we'll talk about the skills for 1 rescuer and 2 rescuer infant CPR. But this time, we'll first learn to check for a brachial pulse. Then we'll cover infant compressions, followed by giving breaths with a bag mask device.
So we're doing the baby now. And the brachial is here. So they're asking that we check for the brachial pulse before we start for those infant compressions.
Okay.
Before we start for those infant compressions.
Is it on the underside or the overside of your arm?
And the inside.
Underside, okay.
Finally, we'll combine all of these to practice 2 rescuer infant CPR.
First, if the cardiac arrest is witnessed, check the infant for a response and breathing. If the infant is unresponsive and isn't breathing or is only gasping, send someone to activate the emergency response system and get an AED. If you're alone and don't have a mobile phone, take the infant with you to phone emergency services. Or, if necessary, leave the infant and find a phone. But if no one witnessed the infant's collapse and there's no response or breathing, check for a brachial pulse immediately. If you do not detect a pulse, perform...
Where's the brachial pulse?
Right here.
Okay, on either arm.
Either, okay.
2 minutes of compressions and breathing before activating emergency response, if it hasn't already been activated.
If an infant has an adequate pulse but isn't breathing normally, rescue breaths may be required. Deliver 1 breath every 2 to 3 seconds,
see those pads,
which
Cameron?
is about 20 to 30 breaths per minute.
1 on the front, 1 on the back, because
To
it's a
check an
baby.
infant's brachial pulse, first place 2 or 3 fingers on the inside of the upper arm, between the elbow and shoulder, and no more than 10 seconds. If there is no pulse, or if the heart rate is less than 60 per minute with signs of poor perfusion despite adequate oxygenation, begin CPR.
To begin CPR, there are 2 options for hand and finger placement when performing compressions on an infant. The first technique is to place the tips of your 2 fingers on the sternum or breastbone in the center of the infant's chest, just below the nipple line, but be careful not to press on the bottom of the breastbone.
The other is the 2-thumb encircling hands technique. Place both thumbs side by side in the center of the infant's chest on the lower half of the breastbone. In very small infants, your thumbs may overlap. Don't apply any pressure on the tip of the breastbone. Now, encircle the infant's chest and support the back with the fingers of both of your hands. In this position, both thumbs will be used to
Whether using the 2-finger or 2-thumb encircling hands technique, once in the correct position, push hard and fast to a depth of at least 1/3 the depth of the chest, or approximately 1.5 inches or 4 centimeters. And the rate needs to be at least 100 to 120 compressions per minute. After each compression, allow the...
So for an adult, it's how deep?
2 inches.
For an infant, it's how deep?
1.5 inches.
2 inches?
For a child, it's
2
how deep?
inches.
How much?
2 inches.
Good job.
Thank you.
chest to recoil completely.
As we get ready to practice infant chest compressions, remember these key points. Deliver compressions at the rate of 100 to 120 per minute. Make sure the depth of the compressions is at least 1/3 the depth of the chest, or approximately 1.5 inches or 4 centimeters. Allow the chest to completely recoil after each compression, and count out loud as you deliver 30 compressions. So, let's get into position to practice.
All right, what you want to do? You want to do the 2 fingers? You need a little more time. You want to do the 2 fingers, or you want to do the circle?
I would like to do the thumb in circle.
Okay. Ready?
1.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Out loud. 1,
2, 3, 4, 5, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15,
Good. Come on, finish up. 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Let's look at the technique for delivering infant breaths with the bag mask device. This is similar to the adult bag mask technique we practiced earlier. 2 things to note before you start. 1, make sure you have the right size mask so that it isn't too big or too small. And 2, remember that chest rise is the most observable sign to determine the effectiveness of your rescue breaths.
First, position yourself directly above the infant's head. You'll use the EC clamp technique that you learned earlier. But be aware that if you tilt or extend an infant's head beyond the neutral position, the infant's airway may become blocked.
Ensure a tight seal between the mask and the infant's face, and squeeze the bag with your other hand to deliver just enough breath over 1 second to make the chest rise. If the chest does not rise, then you're not providing adequate breaths. Adjust the mask, reposition the head and neck, or administer a larger amount of air.
You don't want to cut off the
Now,
airway. So
let's practice 5 sets of 2 breaths. Deliver each breath over 1 second. Deliver just enough breath to make the chest rise, and make sure you have a tight enough seal with the mask on the infant's face. We'll pause here while everyone gets into position. Follow along with the video. Here we go in 3, 2, 1.
Give 2 breaths. Give 2 breaths. Give 2 breaths.
Make sure it's a tight seal around
Give
that
2
chin.
breaths.
No, that's too.
Not too high because you don't want to cut the baby's airway off.
And give 2 breaths.
All right, Cameron, you try. Tilt the head a little bit. Tilt the head a little bit. Just a little bit.
It's hard.
Okay, just a little bit. Pull the baby closer to you. Okay, now tilt the head just a little bit. Hold the top. Yep. Good. 2 breaths. You got the bottom held down too? 2 breaths. Pause. 2 breaths. Pause. 2 breaths. Pause. 2 breaths. Okay.
Now it's time to practice 2 rescuer infant CPR. But before we begin, let's note a couple of differences between 1 rescuer and 2 rescuer infant
between
CPR.
the 1 rescuer and the 2 rescuer.
One difference is the hand and finger placement for giving compressions. In 2 rescuer CPR, the person doing compressions should always use the 2 thumb encircling hands technique.
The other key difference between 1 rescuer and 2 rescuer infant CPR is the compression to ventilation ratio. As mentioned before, instead of a 30-to-2 ratio in a 1 rescuer situation, 2 rescuers should use the ratio of 15 compressions to 2 breaths. So let's practice compressions for 2 rescuer CPR.
All right.
As a reminder, make sure your rate is between 100 to 120 compressions per minute. Use the 15-to-2 compression to ventilation ratio because you have 2 rescuers. Make the compressions approximately 1.5 inches or 4 centimeters deep.
You did the bag last time.
Allow the chest to fully recoil after each compression,
and I want you to do
and
the
count
circle
out loud
compressions
for your partner.
for the baby.
Time to practice 2 rescuer infant
wait for the
CPR,
video. We gotta
starting
practice,
with
okay?
scene assessment.
We will
do the
pause
scene here while you get into position with the mannequins.
Let go of the baby. We're going to do it all the way from the beginning, okay?
I can't do it like that.
Okay, well, you can move up some, but we're going to do it all the way from the beginning. So let go of the baby. And do it with the video.
Go in 3, 2, 1.
Hold on, Cameron. Make sure the scene is safe. They don't know what happened to this baby.
Hey, are you okay? Are you okay?
Bottom of the feet.
Are you okay?
Check for that pulse in that arm. You watching for breathing. There's nothing.
Activate the emergency response and get an AED. There is no breathing and no
DJ,
pulse.
go. Get an
1,
AED.
2,
Activate
3,
the emergency
4,
response.
5, 6,
Good
7,
job, Cam.
8, 9, 10, 11, 12, 13, 14, 15.
Only 15. Remember, when you got 2 people, 15. DeAndre, look at that
1,
mask.
2, 3,
Thank
4,
you.
5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
2 breaths.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
They checking to see. All right, that was good, y'all. Good job.
I don't know if you said check their feet, check their feet.
Yeah, at the bottom, you know how when you go to the adult and you're tapping, hey, are you
I
okay?
was like this.
Oh, for the baby, you tap the bottom of their feet and ask, are you okay? Okay?
Can we start that over? I did it wrong.
They'll do, huh?
Can we start that over? I did it wrong.
There are some differences when you're using an AED for
No, you did
infants
not.
and
You did
children
right.
younger than 8 years old. Some AEDs can deliver either an adult shock dose
We're gonna do this
or
AED.
a child dose for children younger than 8 years old. A pediatric capable AED will have features that allow a child appropriate shock, but the available features depend on the type of AED you're using.
Your AED may also include smaller sized pads that are designed for children younger than 8 years of age. If it does, use them. If not, use the adult pads, but make sure that they do not touch or overlap. But never use the child pads for an adult. The shock dose delivered by child pads is too small for an adult and likely won't be successful. It's better to provide high-quality CPR than attempt to shock an adult with child pads. Some AED pads recommend placing 1 pad on the chest and 1 pad on the back for infants and children.
It shows you just like
Follow
that.
the
1 pad
pictures on the
chest,
pad
1 pad on
packages
the
for
back.
proper placement.
If an infant needs defibrillation, a manual defibrillator is preferred. But as we mentioned before, this device is quite different from an AED, and it requires special training that is not included in this course. If a manual defibrillator is not available, an AED with a pediatric dose attenuator is preferred. But if neither is available, you may use an AED without a pediatric dose attenuator.
All right, so if you have to put the AED on, Cameron, how you gonna put the AED on the baby? You ain't gotta press it. Just show me where you gonna put those pads at. Go take it off. Where you gonna put them?
Here.
Put them on her. Look at the picture because this is an infant. Where the other one gonna go? Turn them around. No. Look at the picture. That's why I told you to pay attention. Turn the baby around. One goes on the front and one goes on the back. Make sure you don't smash the baby's face into the table. Just pick her up with one hand, with your palm of your hand. Okay. All right, put them back on there. Now you know one goes in the front, one goes in the back.
Adult patient.
DeAndre, you don't push it. Turn it off.
Patient. Do not touch the patient. Analyzing.
Because I just wanted him to put those pads on so he'll know where they go. You don't ever turn the AED on after you put the pads on. You let the AED tell you the instructions. Okay. But now you know, for the baby, you put them where?
In the back and the front.
Yep. All right, you take them off, put them back, and let's finish up. I'll wait till you guys are done. Oh, baby. We're going to do some relief from choking for the baby.
When food or other items block a person's airway, choking occurs. In a severe airway obstruction, the person usually has signs of poor air exchange and breathing difficulty, such as a silent cough, an inability.
We're going to do some relief from choking for the baby.
When food or other items block a person's airway, choking occurs. In a severe airway obstruction, the person usually has signs of poor air exchange and breathing difficulty, such as a silent cough, an inability to speak or breathe, or cyanosis, that is, turning blue. Adults or older children who are choking may clutch their neck with both hands, making the universal choking sign. If someone indicates that they are choking and cannot talk, you must act. For someone who is standing, you'll perform an abdominal thrust.
To perform an abdominal thrust, stand or kneel behind the person and place your arms around the waist. With one hand, locate the navel. Then make a fist with your other hand and place the thumb side of your fist against the person's abdomen, just above the navel and below the breastbone. Grasp your fist with the other hand and press your fist into the abdomen with a quick, forceful upward thrust. Repeat thrust until the object is expelled from the airway or the person becomes unresponsive.
If you can't wrap your arms around the waist,
if you're not able to relieve choking in an adult or child, or if the person becomes unresponsive, have someone activate the emergency response system. Then lower the person to the ground and begin CPR.
perform CPR as usual, but with one difference. Each time you open the airway to give breaths, look for the obstructing object in the back of the throat. If you see an object that can be easily removed, carefully remove it. But do not perform a blind finger sweep because this may cause the object to become lodged. One difference. Each time you open the airway to give breaths, look for the obstructing object.
So why won't you put your finger in the person's mouth if you're looking for an object?
If you do a blind finger sweep, it can cause the object to be lodged further into the person's throat.
Right. So you don't take it out unless you can physically see it.
In the back of the throat. If you see an object that can be easily removed, carefully remove it. But do not perform a blind finger sweep because this may cause the object to become lodged farther back in the airway.
Choking is also a fairly common emergency in infants. The steps to relieve choking in an infant are quite different from those for older children and adults. If you find an infant who is choking but is still responsive, first sit or kneel with the infant in your lap. Hold the infant face down and resting on your forearm with the head slightly lower than the chest.
This might be a little hard for you. DJ, get the baby. Mm-hmm. You see how she's positioning the baby?
Yes.
With the baby, you got to put her hand underneath. Let me see. Let me see if I can demonstrate. Put your hand like the legs here, and you put your hand on his face.
Okay.
Okay, so it's easy for you to flip the baby when it's time to flip the baby.
Okay.
You want to do it, yep, just like that. All right, and then kind of hold it. We're kind of holding them down a little bit, like this. Okay?
Okay.
All right, now look at this picture when you do the thrust. Right, yep, just like that.
Support the head and jaw with your hand. Avoid compressing the soft tissue of the infant's throat.
Then, rest your forearm on your thigh to provide support. With the heel of your other hand, deliver up to 5 forceful back slaps between the infant's shoulder blades. Deliver each slap with sufficient force to attempt to dislodge the foreign body. Then, place your free hand on the infant's back, supporting the head with the palm of your hand. This will cradle the infant between your 2 forearms as you turn the infant over while carefully supporting the head and neck.
You're looking for this object.
Keep the infant's head lower than the chest and deliver up to 5 quick downward chest thrusts in the same location where you would perform compressions, just below the nipple line, over the lower half of the breastbone. Do this at the rate of about 1 per second. Repeat the sequence of 5 back slaps and 5 chest thrusts until the object is removed or until the infant becomes unresponsive.
So don't flip your hands. So let me sit right there on the side. Let me see. So we got the baby right here. The arms, the legs over your arm. My hand is holding this baby. So if I sit right here over the edge and I got this baby, you do this how you do the front. You do 5, and then same difference. Just flip the hands. You trying to do the hands too, and then you just gotta do it with the other hand. And it's quicker when you flip the baby. You do the 5.
Okay.
And then you switch the hands. You know what I'm saying?
Okay.
It's easier when you want to come on the edge here. Usually, like, you could be in a chair. Not on the couch, it's a little bit more difficult on the top. Can you sit up?
Okay, so.
You want to practice first before I put the, before you do it with the video?
Yes. Can I do this on the table?
No.
No.
Because the baby's got to be at a slant.
Okay.
So you need to sit on the corner of that couch. What's wrong with you?
No.
Sit at the corner of that couch.
Okay.
Do the back thrust first. Okay, do 5.
Okay. 1, 2, 3, 4, 5.
Flip the baby. Do 5.
1, 2, 3, 4, 5.
Flip the baby. Do 5.
1, 2, 3, 4, 5.
Flip the baby. Do 5.
1, 2, 3, 4, 5.
All right, we're gonna do it with the video. Cameron, did you see the demonstration?
At what point would I check if there's the food
in between the two 5s? You do the first set 5 and 5. You can check and see, and then continue. You don't want to pause in between.
Okay.
Now that you're in position, let's begin. Follow along with the video as you practice.
Okay.
Here we go in 3, 2, 1.
1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3,
so you're
4,
looking when
5.
you're giving those chest ones. You're looking in the baby's mouth to see if anything comes out.
1, 2, 3, 4.
Okay, remember they got to be slanted though. Give us a cam. You got to do the back thrust first. You want me to teach you how to show DeAndre? Yep, on your arm, just like this. Slanted, just like that. Good. Do the back thrust with that hand.
2, 3, 4.
Now, flip the baby. Good. Now do your...
1, 2, 3, 4.
And while you're doing that, you're kind of looking to see if anything is in there. Now, flip the baby.
1, 2, 3, 4, 5.
Flip the baby.
1, 2, 3, 4, 5.
Good job.
It'll make a clicking noise when you hit it.
Cause I'm weak on my left hand.
get that strength bump.
Better get your strength up.
It's gonna be harder to do it on an actual person, actual infant, rather than a plastic mannequin.
Okay, bro.
Okay. Are we complete?
As with an adult, if a choking infant becomes unresponsive, shout for help and have someone activate the emergency response system. Then, lay the infant face up on a
Tired?
hard, flat surface.
Just about done,
You'll
okay?
perform CPR as usual, but with one difference. Each time you open the airway to give breaths, look for the object.
To give breaths for an infant, the mouth-to-mouth and nose technique is preferred. For this technique, you will first open the infant's airway with a head tilt chin lift. Then, place your mouth over the infant's mouth and nose to create an airtight seal. Give one breath, blowing for about 1 second.